Philippe right now.
Mesdames et messieurs, ce matin, lors du Conseil de défense, le président de la République l'a confirmé. Au vu des résultats sanitaires enregistrés ces derniers jours, la levée progressive du confinement peut être engagée ce lundi 11 mai.
On this Monday, the 11th of May. This is a new phase in the fight against the epidemic. It's a piece of good news for France, for French people.
Nous allons débuter
We will start next Monday
très progressif, au minimum sur plusieurs
to
semaines,
lay down
va
a
permettre aux
progressive
pays de sortir
phasing out of the lockdown. The exiting of this lockdown will be sure but progressive. Many countries in the world have been under lockdown, just like France, for many weeks. France has been under lockdown since the 17th of March. The spirit in which we're working is something that you know very well. We're constantly looking for the right balance between the essential relaunching of normal life, of normal family, economic, cultural life, social life, and our normal health life, and the essential respect of all the precautions that must be taken to stop the epidemic from bouncing back, so to protect our citizens. This balance has to be maintained. This is not one of the priorities that has to be maintained over others, but this has to be a right balance, and that is the fine line that we have to walk. You also know our method. I have asked Mr. Jean Castex, who is an official and also the mayor of a town in the Pyrénées-Orientales region, I have asked him to set out a very concrete strategy, bringing together all the different players of the local authorities, the social partners, scientists. His final report was accepted this morning by the French President during the Defense Council. It will be made public in the following days. It is based on a strategy that I presented on the 28th of April last in front of the National Assembly. It was necessary to get Parliament's opinion on this, and it was also important to present the strategy early in order to confront it with the reality on the ground, and also to leave local authorities, to give them the time to prepare themselves for the easing of the lockdown. This is where we are today. Today, we have some good news and some slightly less good news. The good news is that we are now able to agree for the whole of France to come out of confinement. The less good news is that certain departments have less good results than could have been expected. The map of France that will be presented to you by the Minister of Health in a few moments is very clear. The country is divided in two. In most of France, we have managed to slow down the wave of the epidemic. We have created margins of maneuver for the hospitals, and we are ready to roll out tests. So these are green departments. If departments stay green for the next 3 weeks, we will be able to, at the very beginning of June, to set forth a new stage of deconfinement, opening up high schools, lycées, opening up cafes and restaurants. Of course, in so far as the health conditions will allow this. In other departments, the virus is still actively circulating. Hospitals are still overwhelmed. These are the red departments. Coming out of lockdown in these departments is possible with certain restrictions. Middle schools will not be opened. Parks and gardens will not be opened either. In these red departments, there are two specific situations that have to be also mentioned, Mayotte and the Ile-de-France, the Greater Paris area. In Mayotte, the number of cases is low, but it is rising. In the Greater Paris area, the number of cases is going down, surely but slowly, but it remains high, higher than what we had hoped for. That is why, in these two specific territories, we will have to be especially vigilant. In Mayotte, we have decided to delay deconfinement in order to give ourselves all the means to be able to manage the epidemic. In the Greater Paris area, given the trend that is good, we can start deconfining. But since the virus is still actively circulating, and because this region is obviously very densely inhabited, very crowded, because there are many human exchanges in this region, this means that we will have to be especially disciplined in the Greater Paris area. Ministers will explain the finer points of this discipline. I, however, would like to underline 2 points. During this epidemic, we are doing everything to protect those who are most vulnerable: the elderly, people who are afflicted with diseases such as obesity, diabetes, breathing, respiratory problems. We've said it, the President has also repeated this, and we will not go back on this. There will not be mandatory confinement for vulnerable people after the 11th of May, even in the Greater Paris area. But what I'd like to say to all the people who know that they are vulnerable, maybe because of their age, maybe because of the illnesses I mentioned, maybe because they are elderly and they suffer from some of these diseases, please continue, for your own security and that of others, please continue to respect as far as possible, in a voluntary manner, please follow the very strict preventive measures that have been in place for the last 2 months. We trust people who believe that they are vulnerable. We trust that they will protect themselves. We are not going to order them how to behave. We just need to realize that we have to be careful when we go outside, or when you're welcoming your friends or your family at home. Please take the necessary precautions to make sure that you're protecting yourself and protecting others. The second important point in the Paris area, which I'd like to underline, is that of public transportation especially, and transport in general. Public transportation is essential, and public transportation will not close it, and actually have never been closed during this crisis. But for at least the first 3 weeks, we will impose very strict rules in order to avoid these public transportation becoming a vector of the disease. We might also decide on further measures if physical distancing measures are not sufficiently respected and if the situation does not improve. I've said it several times. The goal at hand, not only the government's plan, the goal of all French citizens is to make sure that we are able to live with this virus. We need to learn to protect ourselves from it, because for as long as we will not have a vaccine or treatment, and if we don't have collective immunity, the only way that we will be able to live is to protect ourselves from this virus by scrupulously respecting all the physical distancing measures, the hygiene measures, the protective measures that have been permanently reminded to you. I will now give the floor to the members of the government who are working with me and who are on the very front line of preparing and the implementation of our strategy. And each one will give you some specific points from each of their fields. First of all, I will start with the Minister of Health and Solidarity. Prime Minister, a few days ago I presented the first maps of France before the end of the lockdown. These maps have been tools that have guided us and will continue to guide us in the following weeks. They reflect the situation of the virus circulating on our territory, and they also reflect the extent to which our IC intensive care units are saturated in our hospitals. These maps have raised worries and hopes, but also a lot of misunderstandings. depending on whether the areas were green, orange, or red. I'd also like to repeat that if your department is red, this is not a punishment. This is also not a bad grade. It is simply an assessment of the viral situation on a given territory, which takes into account multiple data. The first indicator is that of the active circulation of the virus. The figures that we have today come from a very solid body of data that we receive every day. It comes from 700 different emergency services and account for 90% of people in emergency units. They are taken every day, and they give us an overview of what has been happening every week. You have seen that and you've seen this on the maps, that the pressure of the disease has gone down. But there have been differences, some of them quite significant differences, depending on the geographical area. If you look at the map, depending on the different territories, you can see the situation. In green, you see departments in which less than 6% of people who go to hospital come there with coronavirus-related issues. In orange, it's between 6 and 10% of people in emergency services are there because of COVID. And in red, departments where between 10 and 100% of patients are treated for coronavirus-related illnesses. The situation is good in most of France. The virus is no longer active, but it is still active in the east of the country, in Franche-Comté, in Bourgogne, in Loire-et-Cher, and it is circulating much more actively in the Paris area, and active circulation has also been noted in Mayotte. The second map, which you know as well, is related to the health capacity of hospitals. Between January and March, we have increased our ICU capacity to guarantee 10,500 beds in intensive care units. Our goal now is to go back to normal capacity, which is 5,000 intensive care beds, in order to be able to take in patients who need other health procedures, and to enable health workers to work normally and to give them a break from this situation. You have to understand that the burden sustained by intensive care units because of the epidemic is very pronounced in certain areas. Given the influx of serious cases in IC units in the last weeks, this is the case in regions that were most effective, such as the Greater Paris area, Eastern France, Bourgogne-Franche-Comté, in the Hauts-de-France, in the Centre Val-de-Loire area, in Auvergne, the Rhône-Alpes, and in Mayotte. In the rest of the country, the situation has, if not gone back to normal, it has been, at least it's become much more acceptable. The results that you can see are an average of the last 7 days. The benchmarks used for this, you can see them on the map in green, when the occupancy rate of intensive care beds is less than 60%, in orange, when this occupancy rate is between 60 and 80%, and when more than 80% of intensive care units are occupied by people suffering from the coronavirus. They are colored in red. As you can see, the situation is quite clear. There are 3 diagonal areas in the country. The green diagonal goes from the west of the country, where hospitals are not threatened by an important influx of severe cases. In orange, the orange area, which goes from the Pas-de-Calais to the Haute-Savoie area, hospital units are more burdened by the influx of patients with severe forms of coronavirus. The red area, which is mainly constituted of the Greater Eastern area, Bourgogne-Franche-Comté, and the Greater Paris area, this area contains the most serious situation when it comes to the intensive care units. There is a third map as well, which you will discover today. This is the map of our capacities when it comes to virological testing. In January 2020, the first PCR test looking for COVID-19 was carried out. Since then, we have not stopped increasing day after day, week after week, our testing capacity in cities facilities, in hospitals, in laboratories, in veterinary laboratories, in the gendarmerie facilities, in order to be able to identify new infections. We have reinforced our teams and our equipment in order to arm our country in testing capacity. In the last weeks, everything has been done in order to put us in a capacity to be able to test people who are vulnerable and all people exhibiting symptoms. France is ready to test massively. Our testing capacity is now at the level of the needs that need to be met. On the map here, as you can see, is very clear. But sometimes there is a gap between theory and practice, and that is why I'd like to invite French citizens who must undergo a test and who might have difficulties in order to carry out this test. I invite them to contact the green number 0800 130 0000 in order to solve the problems that they might be confronted with. As you can see, the different territories will have the capacity to test everyone. The last map is a synthesis of the different indicators. It is a sort of panorama of the situation of the French territories on the 11th of May. This map brings together the three indicators of the burden being sustained by intensive care units, by the local system of testing, and the active circulation of the disease. As you can see, many departments remain in red in the Ile-de-France area, in the Greater Eastern area, in Bourgogne-Franche-Comté. We're looking at regions and not departments because the main criteria we're taking is the breadth of the burden being sustained by intensive care units at local hospitals. And this indicator is something we saw during the outbreak, is something that is mainly measured at a regional level, not at a departmental level. The situation in the Paris area needs great vigilance. We're asking companies to use remote working as much as possible. We're asking the inhabitants of the Paris area to limit their movements as much as possible and asking people to scrupulously obey preventive measures. And when it comes to vulnerable people, please limit your outings and your contacts with other people as much as possible. In the Greater Paris area, we must be extremely vigilant. I must repeat this. Now, I know it's been very difficult for everyone these last few weeks, and I know that everyone would like to go back to a slightly more normal life. But we absolutely want to avoid a return of the epidemic, which would make the situation even worse in these territories. And that is why these are essential preventive measures that we need to respect, all of us together, collectively. This is the situation today. The elements that I presented to you are trustworthy, they are solid, but let me repeat this, and everyone has to keep this in mind. The epidemic changes over time, and what is true today might not be true tomorrow. And so I call I would like to call on your spirit of responsibility, each and all, for the good of all. Thank you very much. Thank you for the maps, for the indicators. Week after week, you said this, Prime Minister, the virus has abated. And so we can progressively ease confinement in the whole of the country. The virus has not disappeared. We must not lower our guard. In the next week, preventive measures and physical distancing will be at the heart of fighting this epidemic. Maybe even more important than they have been, since school life, economic life, social life will start up again. I will explain to you how to act in each situation. If you have symptoms that are those of COVID-19, a fever, a cough, problems breathing, or loss of smell or taste, you have to act. Do not wait for the symptoms to go away. Immediately contact your doctor, and if your doctor doesn't answer the phone, find an emergency service or call, in the last resort, call 15, the number 15, in order for them to send you to a doctor. This doctor will ask you questions and will decide whether you need to undergo a test. Sometimes you will be sent to a testing facility. It might be a drive-in test facility. It might even be something that you can do at home with a mobile team. This test will be fully reimbursed by health insurance. You'll have nothing to pay for this. Waiting for the result of the test, the doctor will ask you to stay at home in isolation in order not to take risks for yourself or your entourage. If the test turns out to be positive, you will be supported throughout your illness. The doctor will contact the health insurance, who will contact you in order to set up an investigation that will aim at identifying the people you've been in contact with around you. And these people will then be contacted, these people that we called contact cases. Your isolation, if you're sick, will last for until 2 days after you are recovered, meaning on average around 8 to 10 days. If your symptoms get worse, if you have trouble breathing, if you have trouble eating, feeding yourself, moving around in your house, do not delay in calling your doctor or, if necessary, calling the number 15, the emergency services. If you, how will isolation be carried out? If you are sharing your home, you will be asked to stay in a single room, avoiding contact with other people who inhabit your house. You will have to wash your hands often. You have to air your room often. You have to avoid touching objects that may be touched by other people you share your living quarters with. And you will have to clean different surfaces that are often touched, such as door handles. If you are with your partner, for example, your doctor will advise you to always wear a mask. You should not have visits except for essential visits. You will be able to get masks in pharmacies without prescription, and they will be covered by Social Security. They will be fully covered by Social Security. If your test is negative, your doctor will reevaluate the situation depending on your symptoms. Now I will tell you what will happen if you are a contact case of a person who has been infected. Usually you are not the person who will call, but you will be contacted directly by health insurance or by someone who works at the regional health authority, who will have been informed of the fact that you may have been in contact with an infected person. If the risk is serious, for example, if you shared a dinner with an infected person without respecting the physical distancing rules, you will be asked to isolate at home, just like a sick person. You will then have to avoid contacts with your entourage. You will have to take your temperature at least twice a day. If you can work from home, that's great. If you can't, then you will have to not work. 7 days after the last contact with the infected person, you will be tested yourself in the same conditions as a sick person. Why after 7 days? Because that is the right moment to be able to locate the virus if you've been a contact case. Before that first week, it might not be possible to see if you are infected. If your test is negative, the doctor would, in certain cases, allow you to ease your isolation, but your isolation will have to continue for another 7 days because one negative test does not completely exclude the possibility of being infected. Whether you're sick or if you're a contact case, if you're in isolation, never hesitate telling your doctor about difficulties you might be experiencing in your everyday life, or to the health insurance if they call you. There are local units that are being set up everywhere with the local prefects in order to be there to help you. If home isolation is if isolation at home is not possible, your doctor can propose that you spend this time in a hotel, for example, and you will be taken care of by local specialized teams. On Monday, the conditions will be set that will allow all the medical staff of the country to go back to a more normal level of activity, because protective gear, and especially masks, will be distributed in larger quantities. 100 million masks will be distributed in next week to the most vulnerable, fragilized people and health workers.
à repousser des dépistages, des vaccinations et parfois un traitement pour une maladie chronique.
We must not create a new crisis on the crisis. And so it's essential for people to go to look for help if they need medical help. I'm asking all our citizens to go back to clinics and hospitals to get the medical help they need for other health conditions. In this period, I'd like to encourage you to keep accessing healthcare remotely if possible. During the crisis, there's new ways of getting healthcare that have become very popular, such as remote medicine, telemedicine. Every week, more than 1 million remote medical meetings are carried out. And so we advise everyone to favorize these remote practices for health and for work. We've chosen to ease strict confinement for all French citizens from the 11th of May, but I'd like to advise the weakest among us because they're sick or because they're elderly or because they have various disabilities, because they're vulnerable. Please be vigilant. Do not take health risks. Please limit physical contacts with your surroundings, with your entourage, and wear a mask every time you go outside. Maybe your grandchildren or your children would like to come and see you tomorrow. Well, you must try and limit these visits, and you must try and respect the preventive measures and physical distancing that is essential, as well as the sanitary measures, including wearing a cloth mask. Don't hesitate to contact your general practitioner, who will give you advice on the measures you can use to protect yourself. This consultation for vulnerable citizens will also be completely covered by the health insurance. And if you need to speak, because isolation can be difficult, there is a number, 0800 130 0000. We can put you in touch with the special service of the Red Cross at home. Elderly people living in nursing homes. We cannot ease restrictions on the 11th of May. People in retirement homes have to be protected most of all. Visits will be possible, but in the same conditions as they are today. In order to be able to confront this very difficult situation, the government is working with all nursing homes and has devoted 475 million euros in extra financing to them. And we want to make sure that all staff in France's nursing homes, regardless of their status, will receive a bonus for their work in this time of crisis. This bonus will be of 1,500 euros in the most difficult departments and 1,000 euros in the other departments. This bonus will be paid in the next few weeks, and it will not be subject to taxation. In the rest of the medical social sector and in the social sector, in cooperation with Julien Normandie, the Minister, a bonus will also be set up soon. Thank you, Minister of Health.
I will now like to hand over to the Minister for Education, because obviously there are a number of questions that people are asking in light of the lockdown and the post-lockdown period. And we will now like to hand over him to hear about what will happen with the schools. Thank you, Prime Minister. As we have all heard, the 11th of May will mark the end of the lockdown, starting with primary schools and then for the 18th of May for secondary schools. And this is applicable for the green departments. This is for a main reason, is because we have to continue education. It is our social duty to do so. Our students cannot spend more than 2 months away from a direct one-on-one contact with their teachers. It is essential, but it is also for a social need, because we have to avoid people dropping out because of the lockdown. And this is the reason that the French Republic ensures that every child has access to teaching. And we have tried to fill the gap with remote teaching over the past few months. We have come up with a very rigorous health system and health measures that will have to be applied in our schools, and these measures can be checked up on via the National Education website. And these are measures that include protective measures that will have to be implemented in classrooms and will be spread out across all schools in France. We are all aware of the work that this is going to require, and I would like to thank all of the local governments, local mayors, who are also ensuring that our schools will be prepared for the time when students go back to class. A message to all teachers who will have to go back to teaching. Obviously, there will be pre-class meetings for teachers. This is a chance for teachers to be able to speak with each other before the students turn up in the days after. On the 12th of May, students will then be able to go back, again depending on the local context. We won't be able to have all students go back at the same time. There are certain classes that will obviously go back first, grades 1 through 5 and 6. Then other certain students will be able to go back sooner, students with a disability, students or children of medical staff who are being put into childcare during the confinement period, they will be able to go back to school as well. There are currently roughly 30,000 children of medical staff who are in need of classes and need to go back to class. These are the most likely people who run the greatest risk of dropping out, and this is why we have to support them as much as possible to ensure that they will get back to normal schooling as soon as possible. Schools will have to take their own specific measures on how to work that first week. Because this is not really going back to school like at the beginning of the academic year. This is going back to school after an extended time, which has come into the middle of our academic year. And for this, things need to be a little different. Some students will be able to go back to class in small groups, for example, 15 per class for primary school, or more for high schools. We also need specific measures for those students who will not be able to go back to school. Again, we have worked between the ministry and local town halls to come up with other activities for those students not in the classroom, either outdoor sporting activities or civic classes. And these, for those students who were still at home at remote schooling, they will be able to continue their classes, or some students will be entirely in remote, some students will be in and part in class, remote class teaching. The measures will be very different. But again, our priority is to focus as much on those people who have the greatest risk of dropping out. I would just like to make special mention of all of the heads of schools who have been working, again, with our ministry and local governments to ensure that this plan will go ahead. In planning the coming week, we have obviously thought that some teachers will have to stay at home for health reasons, or maybe someone in the family is sick, or maybe they will have to stay home because it was a family decision for them to stay home. Given that not all of our teachers will be able to go back to classes, we have worked with local government to try and ensure that as many schools will be able to open as possible, and 97% of schools have prepared ways for nearly all of their schools to be open next week. Obviously, work is still being put in place to ensure that those schools that do not open next week will be able to open the week after. So what we can see is that a good number of schools will be able to open next week. Not all of them, however, but that will happen in the near future. So for next week, roughly 1 million students will go back to the classroom, with 130,000 teachers to be there, to welcome them back. Obviously, we will have to ensure that those students who don't go back to the classroom will be able to continue to have remote teaching. And what I gather is that a lot of families are actually quite happy with the services that we've been able to provide. There are certain areas that we can improve, but we'll be able to continue remote teaching. And again, we'll provide support from our ministry so that all teachers and students will be able to go back to class. We have also put in place a certain psychological service to ensure that those teachers can deal with this going back to school time period. And this is a way where we can have open dialogue, so that months of May and June, which are nothing like our regular months of May and June, the end of the academic year, we want them to be as useful as possible for our educational needs of our students, so that our students can get back on the right track and so that they can build on and consolidate all of the knowledge that they have acquired over the past year. Thank you, Minister. I would just like to add something to what you were saying about the green regions, that secondary schools will be able to go back on the 18th of May as we promised. I will now like to hand over to our Minister for Transition. She will briefly talk to us about one of the major issues for those people who have to take transport. Madam Minister, the floor is yours. Thank you, Prime Minister. The government's objective in terms of transport is to enable all those people who must travel to be able to do so while ensuring their safety and also the safety of those people who work for the transport systems. This means that up until the end of May, by using preventive measures and social distancing, we will be able to do so. For public transport in urban areas, our objective is to try and increase the services as much as possible, all the while managing the demand side of the transport, obviously while ensuring social distancing. These are all measures that have been discussed with those representative bodies of the transportation services and our government. As of the 11th of May, metros, buses, RER and TER services will go back to 50% of their usual service. And we hope to get back to 100% service by the beginning of June. For the Greater Paris area, we will expect to see a bigger increase. For example, the RATP will go from a 30% service level currently to 75% as of next Monday. To ensure the best protection possible for all of our transport users, we currently have 6% of people using that service. We will try and limit that use to only 15%. So obviously that is by limiting the demand side of the equation. And to be able to do that, we want to ask as many people as possible to continue remote working. This is our best way of ensuring people not taking the transport services that we are trying to guarantee during peak hour. We have come up with a charter for the Greater Paris area that we want to be applied, and the government is supporting us in this matter. The Prime Minister, in fact, indicated that it is local governments who are in charge of public services for transport to try and keep public transport available in certain hours of the day to a certain section of the local population. So, for example, in the Greater Paris area, only those people with an employer certificate or those people with a compelling reason to travel will be able to take the transport. And a compelling reason could be, for example, health reasons, or if they have to transport or accompany their children. And this will be applicable as of the first day of the post-lockdown period. Transport providers will have to take the necessary measures to try and limit the number of people loitering in train stations or in bus stations. And this will be by, for example, stopping people from entering those stations or transport at the entry point. And this is to avoid too many people being in the one space at the one time. Obviously, the Ministry of the Interior will present a number of points in a few moments, and we will apply all of those points that he will cover momentarily. To avoid traffic jams which may increase pollution and road accidents, we will also therefore call on you to car share as much as possible. And another way of limiting traffic jams with cars is by opening up a number of bike paths, which you will have already noticed. For the regional transport solutions, they will remain limited for the first phase of the post-lockdown period. For TGV and intercity services, we will go from 7% to 20 to 30% of an operating service, and we will reach 40% of our regular offer by the end of May. Bookings must be made in advance to be able to take either of those trains, and we will only be able to take 50% of those available seats. Obviously, preventive measures on transport are essential. You must wear a mask for anyone over the age of 11, and anyone who is in contact, any staff who are in contact with the general populace will also have to wear masks. Masks are essential and will be provided for those people who haven't been able to get one in the meantime. If you do not wear a mask, you may be fined 135 euros, as the Interior Minister will touch upon in a few moments. You will not be able to board a TGV if you do not have a reservation, and you will not be able to take passport during peak hours if you do not fall into one of the two aforementioned categories. Transport services are currently ensuring that enough is being done to ensure social distancing by marking a number of seats so that you can clearly visualize where you can actually sit and respect the basic rules of social distancing. So this is public transport, given the current crisis and given the exceptional crisis that we are currently going through, then we will have to adapt using exceptional measures. Obviously, it is ensure that we can all work together to be able to overcome the current situation. Madam Minister, thank you very much. I would now like to hand over to the Minister for the Interior. There are a number of issues that he will have to clarify. So, Minister, the floor is yours. Prime Minister, thank you very much. As of Monday, freedom of movement will be back in effect. People will be able to move around freely in the streets without a certificate, no matter what department or what area you live in, with the exception of Mayotte, of course. That being said, the virus does not travel alone. And therefore, we will have to try and do our utmost to avoid travelling during the coming weeks. As Elizabeth Bon just mentioned, the virus will be most easily spread in public transport, and this is why unnecessary contact will be fined. We obviously have a number of fines that have already been brought in place, and they will continue to be applied, 135 euros. For public transport, local government are the first ports of call for those bodies that have to ensure the correct measures are being put in place and ensure that people are being fined if they do not respect those measures. The Interior Ministry will continue to provide 20,000 additional policemen and women to police those areas, those public transport areas, to ensure that the rules are being abided by. And if they see anyone violating those rules, then they will be fined. Again, we have to stem the spread of the virus, and therefore, people will not be allowed to travel beyond further than 100 kilometers from their home unless they have a compelling reason or for work. A work reason is, for example, if they work in an industry where they have to travel, a truck driver or lorry driver, for example. A compelling reason, family reason, is to provide assistance to someone who is vulnerable, or if you need to provide assistance in a time of mourning. Again, the 100-kilometer limit is only applicable if you are in your department where you reside in. You can move beyond the department as long as you respect the 100-kilometer radius. Here is a certificate, a travel permit. It's very simple. You can fill it out either in paper form or digitally, and you can download it from the Interior Ministry website. And these are also available in certain airports, certain train stations, bus stations, and they are essential. If you are checked while you're in a car, either you have traveled further than 100 kilometers from your point of residency, and therefore you must have this certificate on you, or you are traveling for a distance less than 100 kilometers, And if you have your insurance certificate or a bill to show your residency address, then that should suffice. Again, we call on everyone's sense of civic responsibility in these times. The fine remains the same, 135 euros, and it may increase if you are a repeat offender. The aim here is to try and back to a regular social life, all the while respecting the current confinement. Therefore, museums, certain libraries will be able to open, again, those areas where we can limit the entry to those spaces. We will have to put in special measures for those areas. However, cinemas, social venues, concert venues, covered sport venues will remain closed. In terms of sport venues, only those sporting activities that are carried out individually and outdoors will be authorized. In terms of commercial activity, meetings will have to be limited to 10 people at most, again while ensuring social distancing is possible. A new limit on those meetings may be envisaged in the near future. Until the month of September, large events will not be able to be organized. There are a number of questions for beaches, lakes, and other areas. Again, these areas will remain closed. However, regional prefects will be able to allow certain authorizations to these areas, again, if the local mayors will authorize it and ask for it. This is to ensure that mayors are fitted with enough equipment to be able to ensure social distancing in those areas. This is why we have to have constant open dialogue between mayors and local prefects. We are acutely aware of the need for a number of religious orders to be able to organize a number of events. There was a meeting of local religious leaders, and the Prime Minister has also been in contact with them, and we will meet with all religious leaders to try and find ways of ensuring religious ceremonies to go ahead with certain members of the congregation by the end of the month. But this is an ongoing debate. In terms of borders, the rules remain the same. We have to ensure social distancing and protection. In terms of entering and leaving the European area, there will be a progressive easing of those rules, and only when the health situation permits it. And this will be agreed to by all concerned states. Until then, borders will remain closed. As for national borders that we have with our European neighbours, we have decided to extend the current restrictions until the 15th of June at the earliest. Those cross-border workers will be able to continue to work, as it has always been the case since the beginning of this current health crisis. The current draft law that is being voted on by the Parliament will bring in a compulsory 14-day quarantine for anyone who does not fit in one of those previous categories who crosses one of France's borders, even if it is within the Schengen space. While we do have certain measures applied by a number of our European neighbours, we will have to continue to check on those measures to see if they are compatible with French measures. This is why we will continue to have to ensure that there are checks carried out at European borders when people enter European soil. Maybe in the future we will have to have any travel between European countries. For those European citizens who have a compelling economic reason to travel, they will have to have a certificate to be able to do so, and this is in particular for those seasonal workers for the agricultural industry. Again, everyone has to make use of their good sense of responsibility and civicism. A majority of our citizens know what needs to be done. The very small level of fines that have been handed out, 60% of people have been fined, is a testament to how we can abide by the rules and how we can act responsibly. And this is why with prefects and sub-prefects, we have seen them working with local mayors to see that our lockdown strategy has worked, and it is thanks to them that has been able to bear its fruit. Again, we have a common goal, and that is to see this lockdown to its logical end. Thank you, Minister. I would now like to hand over to the Minister for the Economy and Finance, who has a number of points to cover in relation to local businesses and use of masks in particular. Thank you, Prime Minister. The 11th of May is a day where we will see businesses opening again. For the past 2 months, we have lost a lot in terms of growth and in terms of jobs. Therefore, we need to kickstart our economy. We need to do so all the while respecting the current health situation and the health safety of our employees, because businesses do need to go back to work. As of the 11th of May, all those businesses that were closed will be able to open again, with the exception of social venues like cafes, bars, restaurants, as the Minister just mentioned. For those businesses, we will set an opening date at the end of May. I would like to share a word of support for all of those restaurant owners, employees working in the tourism industry, events, cultural industries, in the sporting industries. They are all going through very harrowing times, and my thoughts go out to them. 400,000 companies will be able to open, 400,000 businesses, or 875,000 jobs, thousands of hairdressers, clothing outlets, florists, 3,300 bookshops will be able to go back to work. As for shopping centres that are larger than 40,000 square metres, as the Interior Minister just mentioned, they will be able to open again if the local prefect agrees to it, and with the exception of the Greater Paris area. This is because the current health situation, as outlined by the previous ministers, compels us to delay the opening dates for those areas. Our economy has slowed down, and this is why the 11th of May needs to be a chance for us, an opportunity for us to kickstart the economy, and this is so essential for sectors of our economy, like the building industry, which can open up to and get back to 85, if not 90% of its previous activity levels. And these are sectors where they will be almost back to normal working levels by the end of the month. For the automotive industry, factories will be open once again, and employees will be able to go back to work. I would just like to also say that the Prime Minister and the French President requested us to do so, and as we have done since day one, the state is standing side by side with our employers, small company owners, very small company owners, medium and large enterprises. The state has been on their side, and the state will continue to be on their side. For example, we will continue to carry forward the Solidarity Fund for all of those beneficiaries right up until the end of May. A florist, a bookshop owner, or a hairdresser will open up on the 11th of May, will still be able to benefit from that Solidarity Fund, simply because their regular sales are lower than usual. They will be able to benefit from that fund. Moreover, as ministers have mentioned in the past, employee contributions and employer contributions for the month of May will be completely null and void. And this is applicable to all businesses that had to close down for administrative reasons. They will not have to pay those contributions. Obviously, for us to be able to go back to work, we have to ensure that the health of our employees is protected, and therefore masks must be made available. Masks for healthcare providers, as was mentioned by the Minister for Health, masks will be made available. Single-use masks, or even masks that are made at home using AFNOR recommendations that can be made accessible via the internet. Distribution will happen across the French soil and will be carried out by government agencies, by local government agencies. And I would like to thank all local governments. Major logistics will be put in place to ensure that masks are available in pharmacies, in tobacconists, so that everyone can access a mask. Again, the VAT will be set at 5.5% on all masks that are AFNOR compliant. We need to ensure that everything is in place so that, as of the 11th of May, our economy can be kicked back into action. And the Prime Minister has mentioned on multiple occasions that we are going through unprecedented times and that it will have an unprecedented impact on our businesses, but we need to limit that impact. And I strongly believe that in kicking our economy into gear is a way of getting back to normalcy, and we have taken all of your concerns in mind in doing that. Thank you very much, Minister. Our last speaker to present the deconfinement measures is the Labour Minister. Going back to work is essential for our economy and for the future of our jobs. Companies and employees want to go back to work, but that is not their own concern. And it's not our own concern. We need to ensure that people can go back to work with sufficient protection and safety for their health. And that is why, last Sunday, the government disclosed a national deconfinement protocol for companies, whatever size company it may be. In the protocol, there is obviously the use of social distancing and general prevention behavior, but also the implementation of widespread mask use, cleaning of workstations, and also by creating specific areas within companies where people can work at a safe distance from others. We have met with employers and employee representative bodies to ensure that all employees will be able to implement these rules, implement this protocol in their workplace. The national protocol is available on the Labour Ministry website, and it is accompanied by a number of sector-by-sector guides. And all employees and employers must read these documents because they have been co-drafted by our ministry and the Ministry for Health. There will be 70 of these documents made available as of Sunday. And these are of particular importance to all major sectors. The entire Cabinet is there for all of our companies, but we want to support each and every company. For example, we call on all companies who can work from home to continue to do so. This is of particular importance in the Greater Paris area. In the next 24 hours, we will provide a guide to help companies that were not used to using remote working solutions to be able to do so, because there are some companies out there who still don't know how they can organize their workflows to do so. Also, we want to ensure that companies can, where possible, have differentiated working hours to avoid peak hour traffic issues. Again, we are doing our most to ensure that we can go back to work. But that entails all of us discussing all of the major changes that will come to the way we work. And these ongoing conversations. As for training centres, for apprenticeship centres, we want those centres to be able to continue to open progressively. As of Monday, their teaching staff will be able to go back, and then as of Tuesday, they will be able to go back to class. Obviously, the condition of them going back is that they can abide by the outline of our protocol. We have also met with representatives from the agricultural industry, and we want these training centres to be able to be open as of next week. There, again, is a specific guide which will be available on our website for training centres and vocational training centres. Again, these guides concern everyone, and it is our way of ensuring a post-lockdown period that will be carried out in perfect safety. We have been working with all of these agencies to ensure that we protect the health of our employees, of our trainees, and of our French citizens. Thank you, Madam Minister. Today is the 7th of May. We have 4 days left until the 11th. The coming Monday will be the new step, a new chapter we will be able to get back to our regular social lives. It won't be entirely normal, as has already been mentioned by a number of our ministers, but it will be a new chapter. But it requires all of us, all French men and women, to act disciplined and to act responsibly. And again, this is the first chapter, and the next chapter will last a number of weeks, because the virus will continue to live on with this. But I am confident in our ability to all of us deal with the current situation and to act with discipline and responsibility. The progressive deconfinement that we're going to go through should not see us let down our guard in the coming days, in the coming weeks. We have to think practically, because all throughout May, we will have to, from a government side, adapt our plan to continue the ongoing dialogue with elected officials, to hear the challenges that they are facing and take them on board. I would like to thank from the bottom of my heart all those people who have been able to ensure that the 11th of May will be a success. Mayors, of course, because the mayors are at the very heart of our mechanism here. Prefects, companies, all local health centres, any state officials who have been in their own capacity, in their own function, have in their own sense of responsibility, have been able to help us to prepare and are continuing to enable us to prepare for the post-lockdown period. And from the 11th of May up until the end of May, we will be able to see where we are at. We will be able to take stock. We will be able to say at the end of May whether we have overcome the crisis. We will be able to closely evaluate and monitor new entries to hospital, new cases, new deaths. If these figures stay low, we will be able to move on to the next stage. We will be able to open up to new areas, those key areas for the coming summer. However, if the figures don't change, if they increase, then we will have to take stock of that situation. And obviously, future confinement measures maybe have to be brought back in place. I have to mention that. So therefore I call on all of you, because I think it is going to be a welcome time come next Monday for people to be able to breathe a sense of an air of freedom, to be able to go back out into nature. For those people who have been locked down for the past month and a half, 2 months in the center of our urban hubs, I think all of our French citizens would want to be able to utilize that new sense of freedom. But we also need to stay wary and be precautious. The plan that has just been mentioned and discussed and will be disclosed in the coming days outlines a number of guidelines, not necessarily assertions, but guidelines, and there are some which are very strict guidelines where if they are not respected by, they will entail a fine. But I think what is so important here is not necessarily the fine, but the meaning behind the rule that is trying to be enforced. Why do we have those rules? Because we need to ensure the current health situation of our country, because we need to ensure that we can be in a safe situation to get back to work. And we need to strike a balance there between those different points. We can only strike that balance if we can trust each other. It's not just about citizens having trust in the government or public authorities. It is about trusting each other, people trusting each other. If we can entrust each other with having understood what is at stake here. And me, I have faith and I trust that we have understood and the French have understood. I would now like to field any questions that our press relations secretaries would have for us. Prime Minister for Le Quotidien, Groupe Ebra.